Buenas and Hafa. The Committee on Health and Veterans Affairs is now in session. The time is now 9 o'clock in the morning. It is Thursday, October 9th, 2025. Thank you for joining us today, whether you're here in person at the Guam Congress Building or tuning in online through our YouTube channel. Today's hearing will cover two items: the Governor's appointment of Julienne R. Duenas, physical therapist and doctor of physical therapy, to serve as the physical therapy representative on the Guam Board of Allied Health Examiners. The second item on our agenda is the new fee package for the Guam Memorial Hospital dated June 2025. And just a quick housekeeping note, official notice of this hearing went out to senators, stakeholders, and the media as required by law. It was also posted on the legislature's website and the public notice portal. Copies of today's agenda and supporting documents are available online, and if you'd prefer a printed copy, let us know. Full video of this hearing will be available later on the legislature's YouTube page. I'd like to recognize my colleagues on the committee who are here with us this morning: Senator Sean Gumatautau, as well as Senator Vince Borja. Also with us today is Senator Therese Terlahi and Senator Tello Taitagui. Just a reminder for my colleagues, each senator will have 5 minutes for questions or comments, so keep the discussion moving, and make sure everyone has a chance to participate. We will begin with the first item, the Governor's appointment of Julienne R. Duenas to the Guam Board of Allied Health Examiners. If there are members of the public who would like to testify on the appointment, please come to the table. Julienne, you can also come up. We ask that you speak closely into the microphone and begin with identifying yourself. Good morning and welcome.
Good morning. Good morning, Senators. My name is Brianna Sablan, the Acting Health Professional Licensing Office Administrator out of the Department of Public Health and Social Services. I'm here today to read a testimony on behalf of Director Therese Arreola, Hafa Chairwoman Sabrina Salas Matanane, and Senators of the 38th Guam Legislature. Thank you for the opportunity to present testimony in support of the appointment of Julienne R. Duenas, PT, Doctor of Physical Therapy, to serve as a physical therapy member for the Guam Board of Allied Health Examiners under the Department of Public Health and Social Services, the Health Professional Licensing Office. Ms. Duenas possesses the necessary professional expertise and commitment to uphold the vital mission of the Guam Board of Allied Health Examiners, which is responsible for licensing, regulating, and ensuring the competency of allied health professionals on Guam to protect public safety and welfare. Her professional expertise as a doctor of physical therapy and a licensed physical therapist, Ms. Duenas brings high-level specialized knowledge and clinical experience to the board. Her deep understanding of professional standards, ethical obligations, and continuing education requirements within the field of physical therapy is invaluable, especially in her role as a physical therapy representative. Her commitment to public service, her willingness to serve on the GBHE demonstrates a strong commitment to public service and to maintaining the majority or the integrity and high standards of allied health care across the island. The board's work in initial licensing, license renewal, and investigation is crucial, and her professional background ensures a well-informed perspective on these regulatory matters. Her commitment to a 3-year term from the date of confirmation provides the board with stability, continuity, allowing her to contribute to long-term regulatory planning and policy development. Ms. Julienne R. Duenas' credentials as a physical therapist, combined with her dedication and upholding professional standards, make her an exceptional candidate for the Guam Board of Allied Health Examiners. I respectfully voice my support and urge the 38th Guam Legislature to vote in appointing her to immediately begin her important work in safeguarding the health and safety of our community. Donkulu Nasizios Maasi, thank you for your time and consideration. Teresa C. Arreola, Director of Department of Public Health and Social Services. Thank you.
Thank you, Ms. Blanc. Is there anyone else who would like to testify on the appointment? And if not, Ms. Duenas?
Thank you. Good morning, Senator Matanane and Senators. I am Julienne Duenas, and I'm here because I was nominated by our governor, Lulian Guerrero, to serve as the physical therapy representative on the Guam Board of Allied Health Examiners. I am a physical therapist. I am married to Julito Tingson Jr. We have 2 children, Jordan and Joshua Tingson, a daughter-in-law, Ashley, and my favorite granddaughter, Ava. I've been a physical therapist for 37 years. Most of that career has been on island. I started with working in acute care hospitals, both in Texas and in California. I then relocated to Guam with the FHP clinic. I worked for the FHP clinic up until the late 90s when the clinic was closed and the physical therapy services were outsourced. I then joined a company, Sports Orthopedic and Active Rehabilitation, Inc., also known as SOAR Physical Therapy, located in Tumuning. And at first I was a small shareholder, and by 2008 I became the owner. I have many years, 37 years of clinical practice, and in that clinical practice I've also have had administrative roles and public service. I served on the Guam Board of Allied Health Examiners in maybe the late 90s and ended my term in 2010. And during those days, there were many colorful and exciting things that happened within our profession. As you know, the Guam Board of Allied Health Examiners doesn't just license physical therapists. We license a number of allied health care professionals. And so I have some experience, I have experience in that area. I've done a lot of volunteering. I'm also with the Guam National Olympic Committee. I serve on their medical board and anti-doping commission. I have been a PTO president and just too many. I don't know. I'm six decades. But I would like to tell you that I'm very familiar with the board's duties and responsibilities, and I'm here to champion the professionals in the allied health field. I'm here for the public, right, to make sure that things that happen in the community with other providers that maybe infringe upon our scopes of practices, that we bring that to the light, because you don't hear that stuff. When there's an unlicensed professional that does something that infringes on acupuncture or physical therapy or occupational therapy, you don't hear that in the news. But if it's a licensed professional, God forbid that there was something that didn't have good outcomes, we are in the forefront. And so I'm here to make sure that the public is protected. And that's really my mission for being on the board. And also to add the representation of physical therapy to that board. Otherwise, we're being licensed and controlled by people or professions that are not our own, if you will. And so with that being said, I'm looking at my notes just to make sure I've got everything. Yes, so I'm here to serve to the best to protect the community from an allied health perspective, and it would be my honor to serve on the Guam Board of Allied Health Examiners. Sizuas Masi.
Thank you, Ms. Duenas, and thank you for accepting this nomination. We're going to open it up for questions from my colleagues, but first I'd like to acknowledge the presence and participation of the Vice Chair for the Committee on Health, Vice Speaker and Senator Tony Atta. Thanks, Senator. I'll just ask one question first to kick things off. You mentioned that you served in the 1990s to 2010. What are some of the specific areas of improvement that you see from back then to now that you will focus on? I know you mentioned infringement, but when I was looking at the agenda for tomorrow's Guam Board of Allied Health Examiners meeting, I noticed there's complaints that date as far back as 2022.
So currently, the focus of the board or the big thing that has happened on the board is they have recently passed new legislations that governed and rules and regulations for the board. Some of them we want to address specifically for physical therapists, like dry needling. And so, but I think the improvement has been that we finally got new rules and regulations. The rules and regulations that they were practicing with were since 19 forgotten. And so we need to bring things, up to industry standards. Physical therapists, in particular, have a wide range of modalities that we use that are new and maybe not so popular within the other disciplines. There's lots of turf wars, which you're going to get, and especially on a board that has multiple professions that all share the same or very similar treatment modalities. But I think for the most part, we finally got new rules and regulations. So.
I'm looking at another complaint, and this one is from 2023. It says it involved the procurement of an off-island consultant to assist with the investigation. However, no results from the consultant's report have been received at this time. Dr. Balahaja noted that the process required adherence to government procurement procedures, which introduce additional complexities and administrative burdens. Are you familiar with this complaint and these sorts of issues within the board?
Actually, no. Not those complaints. I am familiar with some complaints with providers and complaints of the past, right? In not necessarily in terms of administrative roles, but more clinical.
Do you? If you're on this board, what will you do to move these investigations forward and resolution to these complaints? Because 2022 is quite a long time.
Yeah, I think the Guam Board of Allied Health Examiners continues to make quorum so they can meet. I think that if I was on the board, definitely listening to it and bringing everybody together to resolve the issues and just hashing it out. That's how I would say I would bring things to the table, right? But I don't know if the reason why those are so long is because it's more administrative and not clinical. Yeah.
Thank you, Ms. Duenas. So we'll now take questions from my colleagues, and we'll begin with Senator Gumatauta.
Yes, thank you, Madam Chair, and thank you, Julienne, for stepping up. I think this is not your first rodeo, so at least, but doing it again. Oh my goodness gracious! And I've had the privilege to be with you at least at one of those Olympic Games. So I want to say it's good to see you again. It's been a long time. Can I ask you a question? I don't know if you can answer this, and I hope you would answer it the best you can. Do you think that the role of the Guam Board of Allied Health Examiners is it a misunderstood role in what they actually and how they serve the community?
We always feel like we're the stepchild, right? Because for providers who are not medical physicians or nurses, they kind of just lumped us into one. And it almost seems like we, those of us who are members who bring to the forefront things in the community that we believe is not safe, and we bring to the AG's office, it really has fallen on deaf ears. There have been multiple complaints regarding several businesses that practice and do things like manipulation, and they're not licensed, and yet we haven't really been able to stop them. And you don't hear about it, right? But we hear about it because they come and see us.
And are they seeing you after maybe an injury or after something bad has happened, primarily?
Sometimes, or sometimes they just mention it. Oh, you're out at a party. Oh, I went to that place and I got my neck cracked. Wow. And I'm like, really? I'm not sure they're supposed to do that.
Right. And with that said, it seems that even in 2025, there are emerging therapies. There are a lot of different types of ways that people can, take care of themselves. And I wanted to go back to the question from our chair, is when we think about cases, are you hoping that if whatever backlog there is, like how fast do you think that with your contribution, that you can maybe get these through so we're not looking at such a large backlog and a timely backlog?
Yeah, if coming in 2025 for something that happened in 2022, it kind of, the writing is on the wall. It may not be quick. I'm not a magician, right? I'm a physical therapist. And so I think that maybe revisiting it and making it priority and having a voice, right, to say, hey, this is what the legislature is saying. Why do we have so many unresolved cases? And being hopefully that new voice, right, and maybe a little bit more energy or a different energy. That's the hope, right, and that's the goal. And again, like I said, if it's I'm confident that when there's a clinical, professional issue that arises to the board in the form of a complaint, it's been my experience that we jump on it. We don't drag our feet. And so I don't know what the case is. I'm sorry, I didn't go and research.
Oh, no, it's all good. I think that at some point, though, when you get in, these won't be unfamiliar types of things you might have heard even in your own clinic. So with that said, Madam Chair, again, thank you again for wanting to serve one more time, and you got my support. Thank you so much for being here.
Thank you.
Thank you, Senator Gumatao. Senator Borja?
Thank you, Madam Chair, and thank you, Ms. Duenas, for accepting the call to serve the people of Guam. I support your nomination. I don't know if you remember, maybe 10, 15 years ago, my brother played basketball at JFK, and even just your volunteer work, I think at the time your son was on the team, he's now a physical therapist, and so, I was actually a patient there too as well. But just the work that I've seen aside from your professional work and your years of, in the, not industry, but profession, I have no doubt that you'll bring a lot of value. But to kind of piggyback on the things that in regards to the investigations, are you, you used to serve on the board, right? You said like in the 90s. Have you reviewed the latest? I don't know if it would be the governing rules or a standard operating procedure for the board, to where you can say you're knowledgeable as to how they address these concerns?
Yes.
Okay. When was the last time? When do they regularly get updated? Is there a time frame on when they get reviewed and updated?
The rules of the board or
Yes.
the rules of each professional?
No, the board and how they handle complaints or inquiries.
I think what happens is a complaint comes into the board, and then it gets reviewed and put on the agenda, and then as a group we address it, and then in the past what has happened is they've called people to the table, those who maybe the complaint is about or those who've made the complaint, and then we decide as a board, how to deal with it.
Okay, but then do these stay open or do they close them if there's no action going to be taken?
They generally will stay open until we resolve it.
Okay.
And usually it may require AG's office to come and provide legal counsel. And in the past, you've had legal counsel appointed to the board, right? In the past, when I served, it was only when it was a high-profile case.
Okay. I think, some of the other questions I had, these guys had asked, but, again, thank you not just for accepting this, but just the work that you've done in the community over the last years, especially with the public schools, because you guys, I think back in the day, JFK had one of the good basketball teams. I think their basketball team is still good, but back then, like the work that you and your husband and contribute to just making sure the athletes were, my brother, I think, even broke his arm, and you guys were still able to provide free not medical care, but to at least assist so that he was able to recover. And so we trust, I trust the work that you'll bring and the knowledge and experience that you'll bring to this board. And so thank you again for accepting the call to serve. Thank you, Madam Chair.
Thank you, Senator Borja. Senator Terlahi?
Thank you, Madam Chair. Good morning.
Good morning,
And thank you for being willing to serve on the board again. And I was going to ask you when you last served. If I could ask Brianna, the acting director of this HPLO office, What do you think are the particular concerns for the physical therapists who are going to be serving on the board? It is a mixed board, as she said.
Thank you, Senator Chilai, for the question. I think right now, specifically for the physical therapists, like Julienne said, the dry needling, that's a big concern. And now going back to Madam Chair's concern or question with the complaints, they are really, since my tenure in the HPLO, I think it's really important to address these concerns immediately. Again, we fall under the umbrella of the Department of Public Health and Social Services. So again, the procurement law has to be followed, and then there are specific complaints that have come to the board that are really out of the jurisdiction of the board. So like dry needling, acupuncture, that's one big thing that keeps coming to the board, but a lot of them are unlicensed. So of course the jurisdiction, we do have to forward those concerns to the Attorney General's office. Those are all still pending. We have not received feedback or legal guidance or how we should pursue those cases. But yes, dry needling is one of the big concerns for physical therapy.
All right, and in April 2024, the news said the AG's office will not prosecute actions against unauthorized practitioners for the board. Is that still their stance, or have you received any other advice?
Well, we just recently have an assigned Assistant Attorney General, Attorney Tillman. So she's been really diligent. I've actually brought her up to speed with everything we're pending. So it looks like it may change because we're getting more responses from the Attorney General and from Attorney Tillman. So we're hopeful that we'll be able to address the 7 complaints that are open, and especially with the unlicensed concerns.
All right, and your enabling law definitely gives you the jurisdiction over unauthorized practice, right?
Correct.
But in order to prosecute those, you need the assistance of the Attorney General.
Correct. And in the last fiscal year, unfortunately, we didn't have our, I was actually going through procurement for 3 different attorneys. So one with the conflict counsel, legal disciplinary counsel, and a prosecuting counsel. So that did not go through in the fiscal year of 25. So that's my intent again, is to try to do that in 26. I've already begun that process, and we're hopeful that we'll get it. But with the assistance with the Attorney Tillman on the board, I'm almost hopeful that she'll be able to help with the unlicensed complaints.
Okay, great. And your budget might cover an investigator this year as well, or shared?
A shared cost with the boards.
With the other boards.
Specifically, the Allied Health would not be able to support it, but if we do a cost sharing, then we would be able to.
Okay. And then the one complaint with the consultant reports not received, is that resolved?
That's not resolved. So one process we've went through that we've always used in the past for the medical board is procure an off-island investigator or an off-island expert. That did not go through. GSA did inform us that that process is no longer allowed, so we had to go through an RFP. And again, that RFP did not basically get processed and approved in 25.
So you have to start again with that one case?
I have to start all over.
With that case?
Correct.
You can't get the report that was pending?
No, I cannot.
Yeah, so these are things that have been brought even to the media's attention over the years. There are several cases, long-standing, not resolved, and I agree with you. It should be for the public that you're serving, and so I'm glad to hear that you're there for the public, and you're there for, making sure that these complaints are resolved. That's really, I think, the biggest concern. Are you willing, and do you have the time to serve on these subcommittees and working groups that they do? Or I think sometimes they assign cases to individuals to investigate.
Yes. Don't tell my husband, though.
Thank you. And do you see? I know the dry needling is part of the rules. It was one of the most controversial topics. So who would that be listed under, and who gets to do that? So I'm happy you're going to tackle that as well. 37 years practicing on Guam. Do you see concerns with your industry that you think that the board should address, besides the unauthorized practice?
I think the concerns come from the growth of physical therapy as a profession and the limitations that we have on Guam, so that when we have new graduates that want to come back home, they can't practice to their ability, for instance, dry needling, because the law is so stringent, right? And so the other thing that, it's not a board issue, but again, it's just the process of getting, it is a board issue, the process of getting licensed, having to have a high school diploma, things like that. It's tedious. And I understand, though, why it's tedious and why it's so involved. And it's because in the past, we've had people who, we'll go practice on Guam. They're not going to check my background. And so we give people licenses, and then we find that there's cases pending against them. And it's so hard to remove a license once you've given somebody a license. So because we were so remote, and again, I've been here so long, now that we have the internet, and so we can check everything and look at other boards. But in the past, we didn't have that ability. So now I think that we want to streamline getting our professionals back home to be able to practice at their full abilities.
Yes, it seems like there's several who are studying or have studied now, and that's great, because it was so rare when you became one, and
Yes.
still rare when I was going through school. So I'm really very happy. I hope you can get them back.
Yes,
I really do.
That's our goal.
That's great. And I know that the board has gone through some processes to streamline a little bit of the putting things online. I think also the renewals with the notary process and all that. So hopefully that helps, but I'm sure they will be open to any of your suggestions. But I want to thank them for the improvements that they have made. But I do agree. It's these complaints. So it looks like, I don't know, the physical therapist representatives has not really been at the meetings. Maybe there are no complaints against physical therapists, but I still hope that you will attend the meetings so that you can help the whole board in general. They need your help, I think.
In the past, I've attended most meetings, and the board never had to cancel a meeting because of lack of quorum. So I think I take pride in that. So we'll be there.
All right, great. All right, well, I appreciate your willingness to serve, and good luck to you and the board on its continued, and the office on its continued improvements and continued streamlining. Thank you, Madam.
Thank you, Senator Terlai. Senator Taitagui.
Madam Chair, and good morning to my colleagues, and of course, good morning to everyone who's here and those who are listening this morning for your confirmation hearing, Ms. Duenas. And I too express my donkalusi for wanting to step up once again. And it's not an easy board to serve on as well. There have been controversies in the past. I believe there was a issue with one veterinarian. I don't know if you were there during that time. Yes, you were. So that was probably the most heated that I've seen the board have to deal with. And it's probably not going to stop. Things are becoming more transparent. And I want to make sure that as you sit in this position, if you can give me your word that you truly believe in transparency and that everything would be open.
It's been my practice when I was on the board that for any applicant that came through or any complaint that came through that I that I had dealing with, whether they were applying at my clinic, to recuse myself and to ask for the board members to review their packets so that it would be seen. It's also, you know, it's in my innate nature to be transparent when there are things that come up in the public, and to also to be fair, right? To look at the law and to treat even those who the complaint is against with fairness, right? Okay. To look at, you know, their side of the story.
Okay. Well, there was an issue actually with the Medical Board of Examiners, and the issue came about, you know, trying to close down a meeting to do it in private to discuss, and it was the Attorney General's office that warned them of the open government law. That should not happen. It's good to know that you have somebody from the Attorney General's office to guide you in this scenario. I know in the past when you sat on the board, that was probably one of the concerns, not having a designated attorney to advise you. So it's good to hear that there has been someone from the Attorney General's office that is now going to help advise you. And in a situation, how have you ever dealt, and maybe in the past when you sat there, but going forward is really important. How are you going to address if you see a fellow board member who has definitely a conflict of interest? How would you handle that?
I would, in the meeting, just ask that they acknowledge that there's a conflict of interest, right? And to maybe suggest that they would recuse themselves in the event.
Okay, and what if they refuse to do it, and even though it is a clear conflict of interest, would you vote on something like this, to have the board vote on them to force them to recuse themselves?
I think that if there was a motion that came up that we felt like there was a conflict, I would definitely vote to remove the conflict. Okay. If they don't recuse themselves on their own accord. Okay. Right? Yeah, but I like to believe that we would all do that.
Yes, so would I, but you'd be surprised how many don't.
Yes.
You know, even in this body,
yes.
You know, there's situations that come around, you know, and it's questionable. And we deserve it to the people. You know, if anyone's going to stand up and volunteer to do a service to the people of Guam, you know, it's admirable for them. But it's also responsibility, a big responsibility, you know, for the people of Guam that you serve, that you are serving them, you know, and of course my door is always open if you come into a situation like that. It's questionable and nobody's doing anything about it. You know, I'm inviting you to knock on my door, call me, you know, at any time, and I'll be glad to assist where I can.
Thank you for that.
You're very welcome. I did notice, I'm a real stickler when it comes to website, you know, talking about transparency. And I noticed on the Board of Allied Health that you're very good at posting your meetings. Thank you very much. You know, and there's one meeting coming up. Have you had an opportunity, Ms. Duenas, to actually read the minutes of the meetings in at least the last 3 months so that, you know, as you get your feet wet again?
No.
Okay.
I will.
Yeah, okay. You will, right, though? Just to catch up. I'm sure you will.
I sure will.
Yeah.
I actually didn't know when this was going to happen.
Okay.
I was thinking it was a year.
Oh, okay. No, yeah, we're a little bit faster this term. Okay, and but I do want to bring to the attention of public health that, or those who are handling the website, that the July 11th minutes of the meeting have not been posted. And it's ironic because you have August 1st posted and you have September 5th posted. But for some reason, July 11th, I don't see posted. Maybe I may be wrong, but I'm going on your website and notice that it's not there. So if we can get that updated, that would also help the nominee to, you know, follow up and see what she got herself into.
Thank you, Senator Tailigui. I will take a look at that.
I
I'm
appreciate
sure it's
that.
posted today.
Okay, I appreciate that. And I guess, you know, one last question I have for you is, how do you balance protecting, you know, patient safety with supporting medical professions under investigation? Like patient safety? How are you going to, ensure they're protecting the patient when there's an investigation of, professional?
Well, if there's a complaint, the professional still has a license, and so you can't keep them from working unless. Do you see what I'm saying? So we can have many complaints against us, some of them warranted, right? But I think that once the complaint is there and the person who the complaint is against, the professional, and they come to the meeting and we address it, I think from there the board decides, at what point do they ask for a cease and desist, right? I mean, because there's, because there are many complaints, but not all complaints are life-threatening.
Yeah.
And so maybe I'm not understanding the question.
Well, let's say, for instance, there's been a complaint against one of the professionals, one of the doctors, and my question was, how are you going to protect the safety of a patient, knowingly that someone is under investigation at the time? Is there anything that the board can do to, notify this individual physician is under investigation, just so that they know and have that choice? Now, we all know that sometimes it's not true because of social media, coming out there, you're guilty before proven innocent kind of thing, and it's supposed to be the opposite. You're innocent until proven guilty. But when there is a complaint coming out, especially if it's a multiple complaint about an individual doctor, the protection of the patient is very important. Whether it's from a veterinarian, acupuncture, and anything in the profession that you oversee, there's got to be a way to find a way to, just notify patients so they can make a choice themselves, and I'm hoping that maybe that's something, Ms. Duenas, you can look into on how can this board ensure the safety of our patient while a physician is under investigation.
I hear you, yes.
Okay, I appreciate that. If you can look at, maybe that could be your number one goal. I appreciate it. Thank you again.
Thank you.
Okay. Thank you, Madam Chair. Okay.
Thank you, Senator Taitigui. Vice Chair, Vice Speaker, Senator Ada.
Thank you, Madam Chair. Thank you, Ms. Duenas, for accepting the governor's nomination to become a part of the board. A lot of my colleagues asked a lot of the questions. I think the only thing that remains is there's complaints that have been filed to the board and currently are unresolved, right? And I hope that you guys would be able to find resolution to that and closure. And I think not just for the professionals that it's against, but also for the patients that, file these complaints. I think it's very important that resolution does come, whether it gets dismissed or there's actual charges against. So just something to always keep in mind, right? Because it's just like a case that goes through the courts or something, right? Always the victims are always looking for closure. So that's one thing, and especially in a profession where folks are just weary about, now I'm not going to go here because there's that thought of nothing's ever going to come of it. So why should I complain? And then the case gets worse. And so hopefully you guys will be able to do that. The other thing is the board, with your appointment, is the board fully everyone's there, or do we have any vacancies still remaining?
I can answer that. Thank you, Senator Ada. We have one vacancy, which is the speech language pathologist.
Has anything gone out for a speech language pathologist to come on board? Nothing.
I believe there was a nomination, and we're just waiting for the governor's office.
Okay. Ms. Duenas, when you get onto the board, I heard you say that you're going to make the meetings. You've been making meetings, and your husband, just don't tell your husband. I'm pretty sure he knows by now that you'll be making all the meetings, but we won't tell. That's just kept between us and the 170,000 people that are watching. Maybe your husband is not watching, so yeah. But thank you for your commitment to serve on the board, and we truly appreciate you and look forward to your confirmation on the next session. Thank you, Madam Chair.
Thank you, Vice Chair. I did have just a couple of follow-up questions from some of the issues that were brought up during this discussion. Again, you served, Julienne, from the 1990s to 2010. Did the board have an independent legal counsel at the time, or was it just an assistant attorney general?
There was not one assigned for us. When there was the large case with the veterinarian, that even there was a public hearing, there was one assigned to us. And I think that maybe I don't think they switched off. They stayed throughout the whole case.
Okay. And Brianna, you mentioned that there is one now assigned, Assistant AG Tillman. When did that assignment occur?
That occurred in August.
Okay.
August of 2025.
Yes. Would you say that the lack of an attorney assigned to the board has contributed to the delay of the resolution of these complaints?
Yes, to some part, because there are some that the board can definitely address and find a resolution. But with the 7 complaints that are active right now, I can say that because the investigation has been done by the board member, they now want to get legal advice on the sanctions or whatever decision before they bring it to the board. So they're already completed, these investigations. They're just ready for legal advice on the next step to bring, basically, to present to the board.
What about an investigator with the board? Do you guys have active investigators on the board? Or?
At this time, we do not. We've been trying to at first we were trying to do a procurement with the professional services contract. That didn't work out in two or three fiscal years. We've tried I've even drafted an MOA with the Attorney General's office to utilize their investigators. I still have not received any feedback. It was kind of really in the first two fiscal years back, I was getting good momentum of responses, reviewing, and then it just basically dropped. I'm not even certain that the individual that I was in communication is still employed by the AG's office. I do want to say, though, that when we did have all 3 attorneys, legal attorneys with the conflicts counsel, disciplinary counsel, and a prosecuting counsel, we found that even with our conflicts counsel, they could not take on the veterinarian cases. So really that's the board veterinarian member had a conflict. The attorney that we had, a paid attorney that we were paying out of the Allied Health, had a conflict with the veterinarian. So that's really why we were trying to do an off-island expert, and that did not go through for the past 2 fiscal years. So we're going to try again in this year. But as far as the investigator, we have to create a position. So it's a matter of creating the position, and I'm very close to completing that and working with DOA to create that position, because we do need the investigator in the HPLO to be a shared position with all the 9 boards.
Okay. Clearly, this is a discussion that probably should be explored further. Sorry, Ms. Duenas, I know this is your confirmation hearing. Again, just thank you for stepping up and accepting this nomination, and we will try to push this forward in the November session. So thank you again.
Thank you.
We'll now move on to the second item on the agenda, the fee package for the Guam Memorial Hospital. At this time, I'd like to invite anyone who would like to testify on the new fees, as well as the representatives from GMH. Again, if you could speak closely into the microphone and identify yourselves.
Good morning, Senators. My name is Yuka Hechanova. I'm the Chief Financial Officer at the Guam Memorial Hospital. I don't have any testimony, but we are here to answer any questions you have, or if anybody else has any questions for us. Thank you.
Good morning, Senators. Saidi Taisakan, General Accounting Supervisors for Guam Memorial Hospital.
Name, please.
Good morning again, Senators. Saidi Taisakan.
Saidi. Okay, sorry. Thank you, Saidi. We'll open it up for questions. I did want to start with, because I was reading through the notes from the hearing that GMH held, and I noticed that there was absolutely no one that came to testify on the new fees, but there was an inquiry from Calvo Select Care, Mr. Frankenpio, and he wanted more information, I believe, and had comments regarding the new fees. Can you disclose what those comments were or any potential concerns that he may have had?
He did email later on asking where he could find a copy of the fees, which we do post on our website. So I gave him the link to that, where the fees were. I believe he also separately emailed Saidi about some clarification on CPT codes that were used in the fee schedule.
Have you received any written concerns about these new fees? And if so, could you please disclose?
No, ma'am, we did not. That was the only communication we had in our record.
Okay. Senator Gumatata, do you have any questions?
Yes, thank you, Madam Chair. And for the record, I just wanted to say that prior to the proposed 36 new fees, GMHA informed the Guam legislature on April 11th, 2025 of 87 separate new fees, comprising the following GMHA departments: cardiology, gastroenterology, interventional radiology, laboratory, operating room, pharmacy, pulmonary, and respiratory. The 87 fees, I think that's correct, right? 87 fees.
That's probably from a prior, the last quarter.
So it would be 36 then, we're talking about today, right?
Yes, for
Okay.
today.
So I just wanted to, because I'm just trying to make sure I understand this. This is going back to March 2025. This is an extension of this that we're seeing today?
Yes, we have new fees that we create regularly when we have a new supply or service or professional fee, but we do have the hearings every quarter. So this is happening every quarter.
Okay, got you. Thank you so much. Let me just jump ahead to probably my bigger concern on this outside of just the whole process itself. But based on OPA report 1901 regarding GMHA billing and collections of true self-pay accounts, the OPA found at that time that there had been an inconsistency between the dates when new charge rates should have been effected versus the date when the charges were updated in GMHA's system. This finding was similar to an earlier finding concerning the delayed implementation of a 5% increase for all room and board charges, which were effective, this goes back to April 1st of 2017, but implemented after only the issue was issued. To what extent has, in your experience recently, has GMHA encountered challenges in updating its billing system based on what would be these types of things, the 9,500 professional fees in your charge library that was effective on March 1st, and the annual 5% across the board rate increase on April 1st?
Currently, we do implement the 5% annual increase, which is allowed by the legislature. We have no issues updating it. They're effective April 1st, and we also include them in the quarterly hearings that we have with the payers to inform them. Also, the effective date has been corrected. I think at the time, the effective date of the rates were retroactive, but the system was causing some issues with that. But we make the date of the rates effective the date they should be effective.
Okay, thank you so much. And my only other question has a lot to do with my committee, but What portion of GMHA's total self-pay group, which generated about 10% of your payers, this is going back between July of 2021 to October 22, reflect Department of Corrections inmate or detainee population, and what new information is available regarding GMHA's efforts to have Medicaid cover eligible inmates and detainees whenever they receive hospital service outside of GMHA's and DOC's agreement, which is, I guess, now funded separately.
Going back to the first question, Senator, just to clarify, what percentage of self-pay belongs to DOC?
Yes.
None of it.
Okay.
Yeah, we have that classified under Gov Guam receivables under DOC, because when they're an inmate, they are pretty much under the custody of the government, so they're responsible for those medical bills.
And can you comment on Medicaid coverage of eligible
Yes,
inmates?
now we learned that they will be eligible for Medicaid coverage, so those inmates, when they are admitted, are given the documentation to apply for Medicaid. So we're moving them to Medicaid now while they are our patient in the hospital.
And I'm sure that some of the documentation, do you coordinate that pretty closely with DOC?
With DOC and with public health as well.
All right, thank you so much for that. Thank
You're
you, Madam
welcome.
Chair. That's all the questions I have.
Thank you, Senator Gumatataw. Senator Terlahi?
Thank you. Can you just clarify on the footnote for your minutes of the hearing, it says that received email from Mr. Campillo of Select Care on June 19 requesting to clarify some CPT codes that are duplicated, and that GMHA provided its response on July 1st. What was the response from GMH?
So the response with Mr. Campillo is, we mentioned to him on the email that that's not a duplicate CPT, but rather what we arranged on the charge code for each department, it's the same CPT, but it's by different department requests. So there's going to be a CPT, let's say 99211 for emergency department because they use that CPT, and can be duplicated also on, let's say, outpatient department. So that way we can track what's the income or revenue per department by CPT. It's not a duplicate, but it's categorized per department.
All right, and then when you look at your fees, there's things like naproxen, 500 milligram tablets, 96 cents, pharmacy department, CBT code JB499, revenue code 251. Why was that not on your list prior to today or prior to this quarter? It seems like some of these things, sodium bicarbonate, why are these new?
These are requests coming directly from the departments that are listed there. So whenever they get a new item, and it's usually maybe a different brand or a different dose, a different solution, different vendor, and so in that case, they will request for a new charge code specifically to differentiate what charge code is used for the different things that they use.
All right, because yeah, some of these look like you should have been using them, right?
Yes.
But you're saying, so these might be different brands, but the brands don't
Yes.
show on your new fee schedule.
No, no.
All right, and then the CPT code and the revenue codes are sometimes the same, although the fee model the rate is very different. How does that work in your system?
So revenue code is categorized by classification. So if you've noticed here on the department, when it says pharmacy, the revenue code that assigned to pharmacy is revenue code 250 series all the way to 251, 252. So there's a classification. 251 is, let's say, if it's administered in the hospital, 251 and 252 if it's an outpatient or it's a take-home. It's a take-home medication. Supplies is categorized as 272. So there's a classification for CPT.
All right, so neither of those classifications is what's determining the amount. It's just you're going to have to put in the fee rate into your system for the amount?
When we calculated the charge code or the charge fee, we consider the CPT code and revenue code. So we make sure that each charge code are aligned with CPT and revenue code. But to answer your question, Senator, that there's nothing there that can calculate or for the fee, yes, we use that as a factor because we cannot create a charge code if revenue code is not on that classification.
All right, and so these rates, they match Medicare, or how did you determine them?
So it depends on what the charge code and what kind of services or procedure. So if we're going to get or calculate a fee for a professional fee, currently we're using our reference, the professional fee rate or the PFR. That's where we base our calculation for coming up with a fee. For different CPT code or charge code like supplies, like medication, we use our purchase order to calculate. But so basically, when you say Medicare, Medicare is for professional fee. But currently, we are not using the Medicare because our reference for calculating professional fee is the PFR or physician fee reference.
That's a GMH product, or is that a national?
A national product that we use.
Okay.
Yes.
And are you able to get reimbursed at those rates then by Medicare? Would these be reimbursable at these rates by Medicare?
For the professional fee, no. The Medicare has a separate Medicare professional fee schedule, the MPFS, that they use for those rates. So if we're charging for the PFR, we will only get reimbursed the Medicare rate for Medicare and Medicaid.
Okay, so these might be higher.
Yes.
All right. How has been the implementation of those room rates that were controversial?
They're in effect right now.
Yeah. Have there been challenges to them or any dispute or non-payment?
For HMO, we don't have any more question, inquiries, or challenge from them. But for Medicare and Medicaid, or we call 3M, so even though the room and board, for example, is $3,000 per day, we get reimbursed by per diem rate.
Which is?
Which is currently effective October 15. We have a new rate of 1,300 from 1,600 last year.
It went down?
It's adjusted every 6 months.
Okay, so those went down for Medicare and Medicaid?
Yes.
But they're at the same 2,000 some for the HMOs?
Yes.
Yes.
All right. But they've been paying?
Yes, they've been
All
paying.
right. Okay. Thank you. Thank you for your work on this as well. Situs Masi, Madam Chair.
Thank you, Senator Terlai. Senator Taitegui.
Thank you, Madam Chair. Good morning, ladies. Thank you for your work on this. I know that you mentioned earlier this is done quarterly, which is good. And I don't know what more to say. I had questions on the professional fees too, and Senator Terlahi is, very well versed on this. So I'm just going to take her lead from this. And the questions that she had was very, very good. Answered all mine on my boxes. However, I do have a question though, since I have you in front of me. And these, well, it doesn't really do with these rates, and I hope, Madam Chair, you don't mind if you indulge me on this since I have them in front of me. The $40 million that was appropriated to the Guam Memorial Hospital and the intention of appropriating additional funding, there's a concern that I'm receiving from not a whistleblower, but an individual who wants to be anonymous, that these funds are going to be used for salary increases. Is that true?
No, ma'am.
Okay, so none of that 40 million or anything like that, or
No.
the intention is going to go to salaries?
No, the 40 million is going to vendors.
All capital improvements?
Yes.
Okay.
As
so,
stated in the public law, we are following that public law.
Okay, because I'm hearing differently that, in fact, verbatim, what they're saying is that, sorry. GMH on the scrutinized, okay, utility IT, but they're according to, okay, the hiring concerns now that GMH is promoting hiring and doing above step, changing titles, reducing overtime hours, and et cetera. This is from someone calling my office now. Since I have you in front of me, I want to make sure that this money is going to be spent for vendors, capital improvement, and of course, the chair also has a bill as well as myself, and I'm going to try and make an adjustment to make sure it does not go to salary increases or above step, recruitment.
Yes, ma'am.
Okay.
We're also required in the law to provide a quarterly report of all of the uses of the funds. So we did provide an interim report, but I think by the end of October, we'll probably provide the first of a quarterly report because most of the money will be spent by then.
Okay. Well, thank you so much for answering
You're
my
welcome.
question. Thank you, Madam Chair, for indulging me on that question. Thank you.
Thank you, Senator Taitigui. Senator Terlahi, you did mention that you had one more question?
Just one more. So, for example, there's one item here, $25,000. You're saying it's a new fee for Thoragraft, 2QF or something, 20F. What is this? So, would you describe this is something brand new that you're providing that GMH did not provide before? Is this because of the new machine that you brought in, or what is
Yes, it's a new supply that was actually going to be used on the patient. There was something that happened that it turned out that they didn't need to use it for the patient, but we had already created the charge code for it, so that's why it's on the list. But the item was not used in the patient.
Okay, so the new machine that you have up there, are those all the services from that machine already billed in previous or in existing rates?
I'm not sure.
Can you say that machine again? I know you had an open house and you called us in to see it.
This is item number 17, Senator, is a supply. So I believe this supplies is consignment, and as what Ms. Yuka mentioned earlier, this supply was supposed to be used for a procedure, but we're not sure what happened to the procedure, if it's canceled or what.
Okay.
So, but every time that there's a new supply that is going to use to any procedure, we need to create a charge code as requested by that department. So what happened to these supplies was returned to the vendor, because this is a consignment, I believe.
Okay.
So we don't have these supplies in our possession right now, but we have the charge code.
Yeah.
Yes.
All right. So you're still finding things that you have never done before that need to create a fee. And in the interim, you can't charge it?
No, that's why there's so many supplies that we have, and then sometimes some of the supplies we have will end up becoming obsolete, but there's still a charge code for it. So there's always new things coming up that we purchase all the time. So that's why the list, we do this every quarter, and we never come and submit something to the legislature with nothing. We always have something to submit.
Okay. But you know what machine I'm talking about, the one you had an open house
Yes.
recently? What is that called?
That is the angio suite.
Okay, the angio suite.
Yes.
Have you incorporated all the billings for that new?
Yes, even
new-
before the machine was,
Okay.
we wanted to make sure that we're ready to use the machine and the charge for the supplies that are necessary.
And is it creating revenue for the hospital?
yes, yes, because we're using it. So yes, of course.
So, as expected?
I'm not sure I could answer that right now, but we can analyze that to see. But it is, of course, helping patients. It's a very state-of-the-art machine, so it is helping people. Our issue has always been the majority of our patients really fall under Medicare or Medicaid, and if they are using the machine as an inpatient, then we do not get reimbursed for the charges because it's rolled into that per diem rate that we get from Medicare.
All right, thank you. Thank you again, Madam Chair.
Thank you, Senator Terlahi, and thank you, Saidi and Yuka, for coming down and speaking about the new GMH fees. I'd also like to thank those who came earlier to the Guam Congress building. and as well as those who are joining us online. If you didn't get a chance to speak, you can still submit written testimony to my office by email at office.senatorbree@guamlegislature.com. That concludes today's hearing of the Committee on Health and Veterans Affairs. The time is now 10:04. This hearing is adjourned. Sizu Usmasi.